When I'm asked why has the public plan model worked here in California and why has it worked here in Los Angeles County, I think first and foremost, we've been on a level playing field. We truly have been on a level playing field with our competitor, a private plan. Secondly, we have competed, and we have raised the bar on performance in the competition between a public plan and a private plan. And we've been able to be responsive to the local community. We've been competing with a commercial plan in Los Angeles County for the past 11 years. Through that process, we've thrived, the commercial plan has thrived, and the consumers, the members, have benefited. And we have stable market share between us. We're able to bring up the quality of care through the competition and provide people with a choice between plans. When I say that all health care is local, I take Medicare as an example. It's a national insurance coverage for seniors and people with disabilities. When they decided they needed to manage the care more effectively, they contracted with health plans at the local level because they knew they couldn't do it at a national level. So they went down to the local level, worked with health plans who worked with the local hospitals, doctors, pharmacies, etc. There's an old adage that says all healthcare is local. Well, all healthcare markets are local, and if you've seen one healthcare market, you've seen one healthcare market. Los Angeles is different than San Francisco. It's different than New York. It's different than a small town in Iowa. And I believe that really, if you're going to have public plans, you should have it at the state level or at the local level or regional level. But at the national level, you have one large monolithic plan covering the country with a bunch of individual markets within that country.
But you don't believe that those same things could be extrapolated on a national level because nationally it would be too big and too cumbersome to do?
I think if you have a national public plan, you're going to have one national public plan competing against everything else out there in the marketplace, but only one big, really big national public plan. Doesn't feel like a fair competition, especially if they have rate-setting capabilities, price-setting capabilities. So I think you need competition matched to how the healthcare system works, and right now the healthcare system works at the local level. I buy my services at a local level. I can order a book from Amazon and get it from across the country. But if I need to be hospitalized, I need to go down the block. It's a local marketplace. So that starts to get there.
Right about the Amazon, that's perfect.
I've not used that one before.
But it's excellent. That's exactly it. That's exactly it. You know, are you going to call Washington to get somebody to book you a hospital? No, you're going to go down the street to go to one. So that's
it's a little unfair, but they're all unfair. So.
But that's a good example. That's a good analogy, and I want you to start, you know, think about that.
Okay.
Because that got me drooling as a journalist. I'm like, that is perfect. That's the soundbite I am going to use. No matter how much background you've given me, that's the soundbite I'm going to use because it's easy for me to understand, and I know my viewers are going to understand. According to Howard Kahn, you know, a national plan is just simply too big and too cumbersome. The local market can respond quicker. Soundbite goes in. I can buy a book from Amazon.com, but if I get sick, I'm going to go to my local hospital. So start thinking along those lines. You know, and those are the types of soundbites that, you know,
Okay.
you know, that we like. So
Yeah, I'm usually pretty good with the sound bites for the actual interviews.
Yeah.
So it's a little more
but
structured.
you're trying to
than
sell
others.
it, yeah, because
Yeah.
it's not really a question. You know, right now I'm not really asking you questions. We're just trying to get your thoughts and stuff of, you know, of what it is that you can talk about.
So the other message that I would like to get across, talking about messages the way I'd like to be called in on, it's looking at the whole issue.
Yeah.
People tend to focus too much on one or two sides of it, on a magic bullet. There's no magic bullet. In fact, I'll do a quick piece on that if you don't mind.
Yeah.
So I think one of the mistakes that we make in the whole healthcare debate right now is people are looking for the magic bullet. There is no silver bullet that's going to solve this problem because the problem is really complex. So it's not shoot at the doctors, not shoot at the insurance companies, not shoot at the pharmaceutical companies. There's no real bad guy. It's the rules are set up wrong. The rules of this financing structure, of this healthcare delivery structure, are set up wrong. Okay, so that's more of a... See, just let me ramble on. Just leave the room and I'll come back in a few minutes.
Now you're into it. You know, I like that. You know, your personality has come through. So we've got two really, you know, those are two really good ones. Let's do, along that same vein, since we're on a roll, let's go ahead and do the whole thing about the language. You know, and think about, you know, communities with, you know, cities or places with large, you know, immigrant communities and the challenges and examples. And I would even say, you know, like, think about it. Let's say you get sick, and let's say you get sick in Beijing. You don't speak the language. How are you going to understand the doctor? Well, that happens every day here, and it's very important to understand this and that, because we're talking about the difference between life and death, and, you know, that type of thing. So that is...
Health plans need to set up an environment where the doctors and the patients can communicate. When you're sick, you want to be heard and understood. And that means doctors have to have the ability to communicate with their patients in their own language and understanding the cultural symbols. Because when you're sick, you need the attention now. You don't need it later. You don't need to be misunderstood and be misdiagnosed.
And what are some of the risks of being misunderstood or being misdiagnosed?
In order for a doctor to treat the patient, you have to be able to speak to the patient. You have to be able to understand, to measure the pain. to understand where the pain is, what it's coming from, to do the right diagnosis. If you don't do the right diagnosis, you can't give the right treatment. And if you can't give the right treatment, the patient gets sicker. People can die if they don't take the drugs they're supposed to be given. And if they don't understand why they're supposed to take them, because the doctor couldn't explain it to them, they're often not going to take them. Is that better?
Great. Yes,
Okay.
definitely much better. I think we have enough to be able to get those, and I like. I'll just check to make sure that nothing can be wrong there. Okay.
I remember about 4 years ago, I heard a doctor say, I knew we were in trouble when we started being called providers and not doctors anymore. And a health plan needs to be part of the community that it serves. That's one of the things I love about being here in Los Angeles. I'm getting to know the hospitals, know the doctors, know our members. We open up community resource centers to be able to touch the communities that we're serving and thus understand them better and thus serve them better. Okay. Great.
But did you